Dentistry and General Radio Network presents
the Independent Dental Practice Podcast with Dr. Sonny Spera. In this episode,
Dr. Sonny Spera, the Independent Dental Practice Podcast. My guest today, Dr. Bob Finkel. He's going to tell you what he thinks, and he's going to tell you black and white. We're going to talk about transitions in the selling of the practice and transitioning to the new doctor, and very refreshing. You're not going to want to miss it. If you like the podcast, you like the episode, please click like, share it with your friends, subscribe. If you're not happy or you don't like it, please contact me. Email me, sonnyspera@gmail.com, or call me or text me. 607-624-2962. That's my personal cell phone. This product is only as good as you want it to be, and we'll make it better if we can, and we have. And with your input, we appreciate it. Now, you also have an interest in coming on the show, telling your story, or giving some people your words of wisdom. We'd love to have you. So hit me up there too. Have a great day, everybody. Thank you.
Dr. Bob Finkel, transitioning your practice out with the old, in with the new, and what to watch out for. A discussion with Dr. Sonny Spera.
Welcome to the Independent Dentist Practice Podcast. Dr. Sonny Spera. Today, my guest, the distinguished Dr. Robert Finkel, goes by Bob. Let me give you a little bit of his background. He's got his BS in Union College, Schenectady, New York. Very familiar with that school. DDS, graduate of Emory School of Dentistry in Atlanta, 1979. Licensed to practice in Georgia, Connecticut, Maryland, Massachusetts. Member of multiple academies, I'll name a few: Cosmetic Dentistry, Craniofacial Pain, the ADA, Georgia Dental Society Association, Northern District Dental Society, Study Club, Seattle Study Club. Charter member of Sleep Disorders Dental Society, now AADSM. Member of the American Academy of Dental Sleep Medicine, member of American Academy of Oral Systemic Health and AGD. Fellow in AGD in 85, Master in 1992. Fellow and member in the International College of Craniomandibular Orthopedics. Recipient of AGD Lifetime Learning and Service Recognition. Diplomat, American Board of Sleep Dental Medicine. Accredited Sleep Medicine Facility. Director, Diplomat, American Sleep and Breathing Academy. Graduate of TMJ Framework for Craniomandibular Studies. LVI Dental Advanced Studies, LSU Cosmetic Dentistry Continuum, Coyce Center for Excellence, Tufts University, TMG Orofacial, past president of Atlanta Craniomandibular Society, instructor at Emory University School of Dentistry, associate professor and instructor at Georgia Health Sciences University School of Dentistry. Member of the Gwinnett Country Chamber of Commerce Executive Roundtable. Fields of interest. If you haven't got the idea, folks, that this doc is a committed to lifelong learning doctor, then I could read this again if you need to. Fields of interest: dental materials technology, comprehensive rehab, aesthetics, smile design, bite stabilization, TMJ and facial pain, and sleep disordered breathing. So please welcome Dr. Bob Finkel. Bob, how you doing, man?
Great. In for the essence of honesty, remember that I retired several years back, and a lot of those credentials go back a few years. So I'm no longer in those societies, many of them, but I was. And
you were very active.
Yeah,
let's be honest.
I'm a perpetual student. I'm a slow learner.
I think we all are at some pace, but not all of us are perpetual learners. And I think some of the people that commit themselves to that, like I remember when we got our degree, and they said the only license you're going to have is a license to learn. And I thought it was set. So wonderful. And I think as you get busier too, sometimes you forget, I don't have time to fit this in. But when you make it a priority, right? If that's part of your core values, you're going to make sure that you're taking the CE that excites you and energizes you and teaches you. And I always think never more recharging of the batteries. COVID, I hated it. I don't like the webinars. In-person seminars are a million times better.
I don't think a lot of the younger dentists remember or realize that when you and I were growing up in the profession, there were no online seminars. If you wanted to learn about composite veneers, you closed down your office, you flew to Vegas or Los Angeles or Clearwater, and you spent 2 or 3 days there. Now you can get online and share a lot of that information. But for all of us, that was real expensive in instruction.
Very much. I agree.
I think it's great, current situation, great for learning, but I think it's easy for the younger docs to get so overwhelmed with the amount of information that's being thrown at them that they don't know what to absorb, what not to absorb. And that's where I think, number one, doing one of the recognized continua, whether it's Coyce, Spear, Dawson, Pankey, take one and go through it. And don't try to absorb every aspect. Dentists are overwhelmed these days with the amount of information and instruction available. And I just think it's important to limit what you do and take some continuum continuously through to the end. I have spent 45 years treating sleep, well, mainly starting with TMD and facial pain. And first you have the occlusion approach, then you have the biosocial approach, then you have the anatomic approach, and then you've got the Janet Travell and perpetuating factors approach. And only after going through 7 or 8 different schools of thought can you synthesize your own comfort level where you think patients should be treated without a lot of extraneous work and cost. Good time for learning, but easy to get overwhelmed.
The other thing too, Bob, is not only it's a good time for learning, but the amount of material that's out there that's really not, I don't want to say legitimate, but not backed or have a basis and have a real strong background to prove it, as opposed to here's somebody, they got a gig, they got a shtick, and they're talking about this, or they're posting a lot of stuff and they're marketing the heck out of it. Like marketing usually, in my experience, marketing almost always exceeds science. Like it's way out in front. Right? Ask the people that had their hip replaced, right? And then, oh, by the way, it was the greatest thing. Also, oh, guess what? 2 years later, we're replacing that hip because this material isn't exactly what we thought it was.
I think we both know some of the people that are advertising for CE, and I think we both realize it's a problem, but I'm an old guy. About some things, I have to keep my mouth shut.
No, I get it. I'm just saying there's such a plethora of it. It's hard sometimes to filter out what's legit, what isn't. So our topic today of our conversation is going to be transitioning a sale of a practice. It was a post that Bob put up. I thought it was fascinating. So first of all, talk about your practice and then how you retired and or transitioned out.
I've been in practice when I quit for about 45 years. At about 42 years, I started looking for a seller, a buyer. And I will tell you, if you're looking to sell a practice and you're not just going to dump it, plan on 2-3 years for that to happen, to find the right person, make the arrangements and make it happen. I will tell you.
Let's repeat that for a second, because that's important. 2 or 3 years of searching to find the person, not 2 or 3 years of transition, 2 or 3 years to find the right fit. Go ahead. Keep going. Thank you.
Yeah, and I will tell you that almost every time the attorneys get involved, they will screw up a deal. Because you can have 2 dentists, a buyer and a seller, who are exactly in sync with what they want to do.
Yep.
And the attorneys will come in. It's like a divorce. They will create problems. So you need, I think, get together with someone, say, this is what we want, and then go to an attorney and say, this is what we want. We don't want you turning us against each other. You don't want finding fault where there is none. This is what we both want. Can you come up with a contract? And I think the best way is to find a good practice broker. I think that's critical, because the practice broker is going to know the ins and outs of all of these things that they've seen.
See, I'm surprised you said that. Because there's been many a case where the broker, in an effort to increase the value that they bring or that they are going to receive, can sometimes push some things along. But anyway, keep going. I appreciate your opinion.
So I think that the practice broker is going to have more experience than the average dentist in the pitfalls. What happens if the dentists don't get along? What happens if some of the older dentists' work fails within 2 to 3 years? How is that handled? What happens when it turns out there's not enough treatment available in the practice? How is that divided up? There are just a lot of subtle things.
Just the transition alone. How long is the transition? What if someone wants to sell it and be gone within 2 to 3 months? Just introduce. And then while you're being introduced, what's the fair compensation for the doctor? There's a lot of questions that I think that will come up. And tell me if I'm wrong, because I think you said it without saying it in the exact same words. The doctor selling and the doctor buying need to stay in constant communication throughout this whole process.
If they go through the attorneys and they each have separate attorneys, as an old science fiction writer once said, editors like to piss in the manuscript, so they're getting paid for something they've done, even if it's not needed. And attorneys, I think, have a habit of causing strife where it doesn't need to be to justify what they're charging. And I think you have to be careful of that.
So what in your mind is the best way to handle? Because I do think both people should have their own attorney. They should have their own representation.
Yeah, but first have something drawn up by a broker that, yes, has a commitment to the sale. That's how he or she makes their profit. But you each feel you can work with and can get you all together and go, how do you want to handle this? How do you want to handle that? And be aware that once you then turn that over to the attorneys, they're going to look for things to aggravate the situation. And I had attorneys destroy 3 relationships that I had for a potential buyer that we got along great. And once the attorneys got involved, they were looking for things.
So give us a little more depth, because you and I talked offline, so I have a little bit of a clue. Give us a little bit more depth and color the background. Let's take us through the first sale that was on the horizon.
I'd rather leave it at this. I was never out to make as much money as I could in dentistry. I was out to provide a good service, take care of my patients. I know I didn't make as much money as a lot of dentists. I didn't retire with as much money as a lot of dentists. I'm never going to starve. We're comfortable. But in every decision I made, I tried to make it what is best for the patient at this moment in time. Did I make mistakes like we all make? Yes. Did I succumb to fear of not having enough money that most dentists fall into at some time in their career? Yes. And I've mentioned some things on that later. And I found a couple of good people.
How did you find them? Because you said you got to leave yourself 3 years to find good people philosophically. What worked for you?
I spread the word among websites like Dental Clinical Pearls. Let all the dental vendors in the area know.
Okay.
Good
old school way to do it right there.
Yeah. Let some friends at Panky know. Let some friends that were in the local organizations know. Posted something in the Georgia Dental publication and in the Northern.
So you got the word out.
Yeah. And I ended up with a good person, probably my best fit.
Did you hire a broker right away?
Yeah, there was no payment up front. There was an agreement.
Yeah, no, I see.
Actually, now we went to the broker because I had found someone.
Okay, so you found somebody.
I found someone. We went to the broker, asked him to do a contract. He was someone well recommended by friends I had at Panky. He a well-respected broker across the country. And we said we'd like you to draw up a contract. So he drew up a contract. And then the attorneys started picking it apart. Because one of the things in my contract was that as I got on in years in dentistry, my passion became sleep, dental sleep medicine, and TMJ and facial pain. And I wanted to ease out of general
handpiece.
General dentistry.
You wanted to put the handpiece down.
Right. And then as I sold the practice, pretty much stay on, finish the patients in general dentistry that wanted me, and then move over to sleep and TMD. And should we wanted in the contract that should the buyer decide that he didn't want me in the office or she didn't want me in the office, that was fine. But I wanted to be able to practice sleep and TMD in the area because this is where my referral sources were. And each of the dentists that I had come up with and the dentist that I ended up with, they were fine with it. Once their attorneys got involved, they convinced each of the buyers that I was only out to cheat them, that the second they signed, I was going to open up another office nearby and I was going to steal the patients and do general dentistry and make the sale of the practice worthless. And I had no desire. My passion was dental sleep medicine and TMJ and facial pain.
So let me ask you this now, right?
Yeah.
Let's tie these loops together now. We talked about the doctors have to be really committed to communicating. The broker puts it, the lawyers are going to then divide and conquer almost. What happened to the communication with the two of you in these situations when you had agreed that turned them south?
In each case, almost word for word, they said to me, this is what I'm paying the attorney for. And he says, we're not going to allow it. In almost every case.
So the attorney who's getting paid, the deal doesn't go through and they still get paid.
Yeah.
So they have no motivation to close the deal.
They still get paid for their time. The broker
Regardless.
doesn't get paid. And that's why it's not finding the right person. It's finding the right person, going through the contract, getting it through the attorneys, and finding attorneys that are committed to finding a way to make it work, not producing work for which they can get paid. And I will tell you that I came to the conclusion, maybe erroneously, that if you could find two separate attorneys in the same firm that handles dental and dental transitions,
that's a problem.
And there are several firms like that, but I think you stand a better chance. Actually, what happened, and I won't use a name, is that when we came down to our final contract, my broker, without letting me know, had our end reviewed by one of the attorneys that screwed up first two deals. He said, because I knew I wouldn't want to use him, and he's a shark, but he said, I'd rather have him on our side than the opposite side. So it was funny. I did not even know that this was the attorney that reviewed my final contract and that he was one that had torpedoed the first ones.
That's like a divorce lawyer, right? You go talk to the best divorce lawyers in town, then your spouse can't use them.
Yeah.
So pretty interesting. So the two deals fall through. Now, the last deal goes through. Let's talk about what that looks like in terms of transition. You've already said you wanted to keep two of the areas. Now, I'm guessing the doctor purchasing the practice wasn't strong in those two areas. Is that fair to say?
Correct. He has no interest in it.
No. Okay, even better.
I want to make one point.
Yeah, please do.
In between those first couple of deals that were torpedoed, we probably interviewed at least 6 other dental practices that were interested in buying my practice. And I wanted nothing to do with them.
Well, talk about the gamut there. I bet you had some small group practices, some mini DSOs, talk about what that looks like on a rainbow, generally speaking.
Most of the ones that wanted to buy us were group practices, heavily PPO.
Which is not your model. We didn't even talk about that yet.
Yeah, and once they saw that that was not my model and they looked at our numbers, it was not for a group like that. May have been for another dentist that wanted to run a parallel practice of quality dentistry, but we were not for where most of dentistry is headed right now.
Yeah, I got you.
I don't even remember.
Why did it take so long for that to happen? Like, why didn't they look at the numbers in the prospectus and say, geez, this is not what I want?
It was just an interesting time. It was also around the time of the pandemic. I interviewed probably 5 or 6 different practices and just said, no, I don't want these people taking care of my patients. My wife and I were exhausted keeping the practice going through the pandemic, but we said, no, we're not letting it go to someone that, number one, I would not want to work alongside. Number two, would not treat our patients well. I don't even remember how Yoni, the dentist that bought my practice, ended up contacting me. He was moving down. There were some issues on getting his licensure in time. He made that happen. He made that work. And we just had to go on faith that we could make it work, that the licensure thing would be handled, what needed to happen in the practice would be handled. And a lot of it was just on faith and intention and trust in the other's integrity. Because there are a lot of times he could have walked away or I could have walked away after we'd invested a lot. But we both said, look, we're going to make it happen. So when I posted the original statement on dental clinical pearls, my major thought was I want people to know that when you come to the point of making a transition happen, the doctors can be in accord. They may be simpatico. They may have a similar vision of what they want, that the younger dentist is speeding up, doing more dentistry. The older dentist is slowing down and wants to do less, doesn't want to do management, may want to do just specialty services. And that may be great. One of the problems and the reason I started that thread in Dental Clinical Pearls is the staff can very easily sabotage a transition like that. I've seen it, and I went back through my memory. I know of 7 specific cases in the last several years with dentists of approximately my age, my generation, that once they sold the practice, the staff turned on them. In one, the office manager got really ticked because she felt she'd been with the practice for 30 years, and she felt she should have gotten a certain percentage of the practice sale.
Oh, so she's an owner now. Okay.
And
okay, that's new.
And there were several other things. One assistant said that the retiring doctor slapped her hand and was too rough with the patient, filed a complaint with the board, and a couple of other situations like that. One buying dentist, took over a highly successful practice where the dentist was really superb in removable prosthetics. He doesn't know how to do removable prosthetics. He never sees the patients. The assistants, who simply learned by watching the selling dentist do dentures, do everything. They're not sure how to do it, but they do it because they're told they have to. And the buying dentist never sees the patient. So now the staff is upset because they're in the midst of, hey, I don't know what I'm doing, but I have to do it. They can't blame their new employer. So who do they blame? So my point in that thread is that the staff, either intentionally or unintentionally, will often sabotage the retiring doctor who may have helped take care of them for 20 years, 28, 30 years, because they are trying the same way a teenager gets pissy with his parents or her parents to individuate from them and show their independence. The staff has to show that they are now loyal to the new doctor, their new employer. So one of the ways they do that is by speaking badly about the older doctor.
Yeah, but you know what, though, Bob? Honestly, I think in a lot of situations, it's just to curry some favor with the new doctor.
Exactly.
It's no other reason for it than anything other than that, because now, especially if there's multiple assistants, right?
I think that's critical. They're trying to curry favor with the new dentist.
Yep.
And one of the ways they do that is disparaging the older guy. And there's another subtle way. Somewhere I think I mentioned to you that, and I have to say this in a general fashion, so bear with me. If the staff doesn't like what they feel is the direction of the new owner,
Right.
they may ask the prior owner, the older dentist, the senior retiring dentist, to write a recommendation for them. Now, this is allegedly and hypothetical, okay? So they then go to the retiring dentist and say, would you write a recommendation for me? The older dentist's responsibility is to say, no, that violates the spirit and the word of my contract with your new boss. If you have a problem, let me get the two of you together to discuss it. But no, it would be violating every ethical guideline I live by to write you a recommendation to leave the person I just sold the practice to. If the staff member does something like that, it invokes a very special emotional arrangement. When you have done something that you know makes you guilty, when you've done something that I'll call it an overt act, that you know is not right, and someone around you knows that, they always remind you of what you've done, and you're scared somewhere in your heart of hearts that they're going to let it slip that you did that. So if they can push you out of the practice, you're not around to remind them of what they've done, and you're not around to remind them of anything else that may have been done in the past. And it's a subtle thing. It's the same thing that if you're ticked at somebody because of something you did and you don't want to be responsible, you're going to find a way to make them wrong. So,
see, we're talking to probably the younger demographic. Probably more the people listening to this are on the buying side, not the selling side.
But what I'm saying is the younger dentist has to be aware of this dynamic. So right. I'm not worried about the retiring dentist. He's had his day in the sun. What my point was to the younger dentist is realize these dynamics go on. Because if you're in good relationship with the senior doctor and he's producing and he's following your guidelines and he's accepted your authority and he's basically said to you, look, I don't want to manage. I don't want to boss. That's your job now. I'm here to produce, take care of patients and do what I can for you. And the younger dentist starts hearing some of these things. Be aware of that dynamic, because that staff dynamic has caused more damage in transition relationships than I would ever have believed.
When I bought my practice, there was 2 hygienists and there was a dental assistant, and my dental assistant from where I was an associate came with me. And the hygienist, we had lots of meetings, lots of conversations. So we were going into a practice that didn't diagnose much periodontal disease, had different scales of diagnosis for regular work depending on a person's, we'll call it, position, okay, or their insurance carrier or whatever it was. I was from the school of thought the janitor gets the same treatment plan as the CEO, okay? So yep. we were getting a lot of togetherness, and the hygienists bought in 100%. It made my life so much easier, okay? The dental assistant, she didn't say too much. She was a stronger personality, but a little bit quiet. So I remember working at one point in time, I was working and the patient was like, oh boy, a lot of changes around here. And she rolled her eyes, right? So I was like, okay, we're going to have a conversation and we're going to have a separation. I can't have somebody rowing a boat in the other direction. I don't care if you agree or disagree. In public, we're all one big happy family. You want to pull me aside and have a conversation? That's a different way to handle things. So that was something that I was a little bit attuned to starting out, that in my scenario. But what I've heard some other doctors be, and I'm going to take your scenario, right? And this is what I see, because now I'm on the back 9 of my career, not necessarily that front 9 anymore, right? So you're buying the practice from a dentist tip. Let's say it's a solo doc, been on his own like yourself. but someone else, right? Maybe it's a little more restorative, whatever the case, right? That person has been the, judge, jury, and executioner in his practice, her practice, either or, for their entirety of their career. For them to step back, it's going to be very hard. And I think some people can't do it. They like the authority, they like the autonomy, they like the assistant to come to them. Hey, we want to use this material. Yes, no. Instead of saying, that's not my job anymore, that's your new boss. So I think
I love doing. See, I
that's a
love doing
scare.
that.
But that's a scare for a new doc coming in, because just like you said, if you have the team and the staff circling around their comfort zone, which is the old doc, and the old doc is not, like you did very clearly. And I think about that, like with the referral letter, right?
Yeah.
The person's asking for a personal referral. To me, I would talk to the doctor that bought the practice asking me for a referral. What is your opinion on it? But
That put me in a very
now you're in a
strange
tough spot with
situation.
the person because you just outed them that they're leaving. I get it.
But
But my point is, you're so ethical that there's never a question. But there are docs buying practices that may not have retiring docs that have that same sense of honor and ethics. So
that's what shocked me in the thread on DCP. We exist in our own universe. We think the way we think. I was not prepared for some of the horror stories I heard of dentists.
Well, they're out there.
Yeah. And I understood that after reading some of those replies. So if any folks from DCP end up listening to this, I heard what you were saying, and I was shocked because I would never go into a relationship like that.
So my question is, so let's take it back a step, right? So what would your advice be to a young doc or a young owner potential going into buying a senior doc who's been there for a bit? What are some ways to bring that to the surface, to have questions so that you really understand what the philosophy is and what that person's all about? What would be some suggestions you'd have?
I think the basic premise was that if the buyers, the sellers both have integrity, you can eventually come up with a coup, but you can still end up in a good relationship. Having done that, be aware that the staff dynamics can act to cause a rift between the doctors. And number one, be prepared for it if it happens after the transition. Number two, I think that the junior doc, the buyer, needs to pull aside whoever is disparaging the older doc and say, look, we don't speak that way about that doc here. He has taken care of patients for 40, 45 years. He deserves my respect, your respect, and the respect of the people that have trusted him. You don't go saying things behind someone's back. And realize that some of the things the younger doc is being told may be self-serving on the part of the staff. Don't buy into it without doing a separate investigation. And then some things that I think need to happen beforehand is I think the practice does, from the attorney's point of view, need to have an ironclad seller non-compete clause for anywhere within the practice area of the patient draw. There may be exceptions if
that may be gone out the window from what I understand, that whole covenant. But anyway, go ahead.
Yeah, but now it's back in. But you can structure it as not a non-complete, but you can say that any patient from the practice is it costs a certain amount to take them on as a patient. The attorneys know, and it changes from state to state, but I think as much as possible, you need to have an ironclad seller non-compete clause for anywhere in the practice draw. If the selling dentist does not compete with the buyer, in other words, he provides services the buyer does not.
Complementary, yeah.
Yeah, that's easy.
Which was your scenario?
I think this is critical. The seller must be financially secure. I don't know how you establish that, but the seller has got to be financially secure. So he doesn't feel he has to steal dentistry or lie. He needs to love what he's doing. They need to love dentistry, and they need to have gotten all the management out of their system. So I know that when I sold the practice, it was one of the most freeing things for me. I did not want to manage. I loved when the staff would come to me and say, how do we handle this? And I could look at them and go, that's not my job anymore. If you want me to show you where something is in the office, or you want me to show you where it is in the manual, if you want me to help you with the technique, I'm happy to. But how it's handled in the practice, that's Dr. P. He gets to decide. He's your boss, and your loyalty needs to be to him. So when we sold the practice, I had a meeting with the staff that day, and I said, I signed a contract this morning, and Dr. P is now the owner of this practice. From this moment on, as of tomorrow or today, I am no longer your boss. He is the final authority, and what he says goes. Your loyalty is now to him. I think I deserve some respect for what I've done, but the authority is Dr. P, and your loyalty goes to him. I think if a dentist can't honestly do that, he does not belong staying in the practice. If his ego demands that he stay in any sort of position of authority, not respect, I don't think he belongs in the practice. And to tell you the truth, I am so certain of that the fact that there would be dentists staying in a practice doing what some of the folks posted, these other dentists did, it shocked me. I wasn't prepared to handle that. And hearing some of that, I go, okay, now I know why the attorneys put some things in.
So I'm going to ask you a couple of things that I think are hot buttons.
Yeah.
So dental work fails from the owner. And let's say it's a quick transition. Let's say it's a 3 to 6 months transition. So the doctor sold, he basically introduces, he doesn't really do any work. He finishes up, if he's got some crowns and whatever, he finishes up some work that he's aware of. And now the new doc is in practice 6 months, a year later, crown comes out, the filling breaks, decays visible under recent filling. So we'll call it just failed dental work. That's going to need to be redone. How do you handle that? What's your advice?
I don't think we had that problem, but I think that's a valid question. I think that's more of a broker question. I think if I got, as the selling dentist, if I got paid for it, then I have some responsibility in 1 or 2 years. I think if it fails within the time that the new dentist, to maintain relationships with the patients, has to do it for free, then I think I should pay the dentist, the new dentist, that amount, or have it deducted from what's coming to me. If it's a filling that's been over 2 years, if it's a crown that is less than 5 years old, I did at no charge.
But my point is, though, you've put in some parameters, some structure, and this is fair. You didn't ignore it. So I think that's a real big issue that I think needs to be discussed, because I see it happen.
Oh, yeah. And
So
that needs to be,
Yeah.
with a broker is going to know the ins and outs of that. A good quality broker.
Well, they're going to make a suggestion, right? And then you're going to have it written up so it means something. What if there's unfinished dental work? What if a person comes in, they've had a temporary bridge in for 2 years?
Again, I'd have to think on that. But if I've been paid for it as the seller, I don't get to keep all that money. If the new dentist has to redo everything because it's been a temporary bridge in, and it's going to cost him out of pocket, then that money generally needs to go to the new dentist.
Okay, next question. This I had a hard time putting it into words. What if a patient insists on following your practice rules, not the new practice rules?
That's an easy question. My practice rules no longer apply. The day we sign the contract, the new owner sets the policy.
Okay,
It
so
has
the patient comes up to you in a grocery store, right? Outside of the practice, and they say, "Hey, I see this guy, he wants to do this, he wants to do that, blah, 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 blah. What do you think?"
I say what I've actually said. I've said, let me tell you, I think Dr. P is one of the best younger dentists you're going to find. I'm not there. I can't look in your mouth. I can't see what's happening. I have him do my dentistry. So I need to tell you, I trust his judgment.
Enough
And
said. That's perfect. Now, I had a doctor who's a good friend, and we bought his practice, and we changed a little bit of what they were used to. So when they would ask him, he would say, they have a new way of doing things. And after it came back a few times, because you never know in translation, right? And we finally had a conversation with him. You can't say that, because that indirectly is disparaging. It just doesn't sound proper. I did things the old-fashioned way. They do it the new way. And if, in your
that did come up for me.
Yeah.
Because I'm used to doing gold crowns.
Yeah.
On hard PVS.
Sure.
And when I was in practice, before I sold my practice, when it was just me, I said, I don't believe that crowns done scanning and milling will last as long as the ones I'm doing for you. Because I've seen the results of 30, 40, 50 years, and I've seen the results of the studies. Now, this is before I sold the practice. And I did lose some patients because I would not scan and mill in a lot of situations.
Okay.
And so I lost patients because I said, I don't think it's the best service for you. I won't do it. I said, I do the way that I know crowns last 30, 40, 50 years. The second I brought Dr. P in and we decided we were going to make this work, I shut up. Now, he brought in some very high-end scanning and milling equipment.
Sure.
The second I knew that he was buying the practice, I never said that. If someone came back to me and once the contract was written and signed, I never said that. If someone came back to me and said, you always said you wanted to do it this way, do you think a full gold crown would be best? I would say, yes, I think a full gold crown would be best. You can do it zirconia, you can do it bonded, whatever. I said, if you want to do it bonded or zirconia, then Dr. P is your guy. He's going to do as well as anyone is going to do it. If you're asking me the truth in my mouth, I would put gold on that second molar. I'd put gold on my first molar. He doesn't do gold. I do. And if you want it done and I'm still in the practice, I'll do it. You'll pay the practice and I'll do it. If you want it the other way, Dr. Pollock will do it. And I've had him do that type of crown in my mouth. And then the embarrassing ones were the ones that I'd said it to for years that then decided when I was leaving, they wanted the crown done the way I'd done it, the way I'd told them. And yeah, that was a little bit awkward, but Dr. P was fine with, if they want to have you do that crown, that's wonderful. Where the practice is still getting paid. So that was my position until I sold it. Once the practice was sold, not my position to judge. It's just.
Let me give you one last scenario that I think, because I've talked to a lot of docs that are buying practices, mainly because I've done it so many times, right? If you're buying a practice that's a one doctor practice, there's no associate involved, and you're buying that practice, then you're buying the practice. It's not a two-person practice. So it's a very hard scenario. If the doctor wants to stay on and remain productive, it's very hard because not everybody's going to be able to eat in that scenario, right?
No, you can't. You can't. In a situation where you've got enough.
You just cleared that up in 1 second.
Yeah. If you've got enough dentistry for one dentist, then the reason for the older dentist staying on has got to be that the younger dentist wants some time off, or he wants to offer some hours outside of the regular, or the older dentist has some specialty treatment that the newer dentist, the buyer, doesn't want to provide. But if you've only got dentistry for one person, no, the senior dentist does not get to stay on. That's clear.
Unless the new purchasing doctor says, we're going to transition. You're currently working 4 days a week. We're going to have you go down to, let's say, 2 days a week. I'm going to take the lion's share of XYZ. We can continue doing this. All new patients are going to come my way. Emergencies are going to come my way. We're going to let you, if patients really still want to see, we're going to do that. We're going to do that for, let's say, 6 months. And if it's working out well and the practice builds up, maybe we can continue. But you can't promise that. So you need, like we talked about earlier, you need some type of understanding between the two doctors. And then you need it somehow to be reflective somewhere in your contract.
The ongoing prerequisite for senior dentist staying is that he's got to be an asset to the practice, and he's got to follow the lead of the buyer.
That's great advice. That right there, those are two pearls. Asset to the practice, follow the lead of the new purchasing doctor.
The buyer has to have the right that the split second the senior dentist is not an asset and is not following his lead to say, we don't need you anymore. And that's got to be in the contract. Since the loan and the risk is on the new doctor, they've got to have the final say. And the senior doctor has got to realize that he can be let go on a minute's notice. The only way he is there is by continually being an asset.
The person, what they're purchasing, to me, you strip it out, they're purchasing an income stream.
Yeah.
They're purchasing a practice that does, what was it, 1.2, 1.3, whatever the number is. So the numbers that I'm hoping to get, or if I take a little bit of a hit, maybe I lose 10% of the practice, whatever the case in transition. So I got to expect it to do this. If the overhead's here, I can count on this amount of money coming in. I have my loan to service. I have payments to make, etc. That's where that calculation comes from. And to change it really to the person buying it, that's just not going to work. Your simple rule of thumb is asset, right? There was two things you said. It have to be an asset to practice and follow the lead of the doctor.
Yeah.
And some people can't play nice. They can't handle that, or maybe their idea of it working long term. Now, if there's an associate in the practice who's leaving, so there's let's call it a 1.5 doctor practice. The new doctor buys it. He may say, listen, I'm going to be busy enough. Why don't you stay on for this period of time? Because we have a 1.5 man practice. And if we build it up, what's your hours? Do you want to keep working? Do you want to add days? But let's talk about where we're going to start.
And the other scenario that leads into that is one example. One dentist I know easily produces 1.8 million a year. A newer dentist starting out is not going to be able to produce close to that. So if the younger dentist starting out produces at his full capacity and learns from the older dentist as the older dentist winds down, that's a great situation, because then the practice doesn't lose production. That's the best of both worlds. It is a great
situation, but I don't think I could make that blanket statement that I don't think a younger doctor can, because a younger doctor may have different skills. But if you're saying the efficiency and the type of dentistry, that's one thing. But if the new doctor comes in and they can also do complementary things, let's say doctor doesn't do endo. Oh, I love to do endo. Boom, that's going to add some revenue. I place implants. Oh, I send all my implants out. Okay, boom. And now you could really have a very nurturing situation that both are providing value. Like you said, both of them are an asset to the practice. Now, the dilemma is going to be for the doctor that bought the practice, how's he going to replace the doctor that's going to be retiring, because he's doing things that he's not doing. So you have to account for some of that.
I think all that has to be accounted for. I will tell you that I think the basis of our mistakes in practice, our mistakes in these transitions, all come down to fear.
That's pretty close, yeah.
Because we're afraid that we're not going to make enough money to pay the bills.
Yep.
We're afraid that we're not going to make enough money to pay the staff. We're afraid that we're going to screw up and our reputation is going to suffer.
Afraid
And
of
we're
making a mistake.
taking-
I was just going to say that's
Yeah.
a huge overhead because you're there. You're there for keeps now, right? You're not transitioning. You're not an associate. That baby is yours in the next 10, 20, 30 years. That's on your resume.
So yeah, the problems we run into with the transition are that the junior doctor makes decisions out of fear of not being able to cover the nut. The senior dentist makes decisions, bad decisions out of fear. If they're not financially secure and okay with themselves, they're going to think they have to stay in there and cheat. So it's just to be aware that so much of what we do is based on fear. It also causes us to take on cases we shouldn't because we're afraid we need the money. Or when we run behind, we're scared of saying, I'm going to have to reschedule this patient to finish the endo and take another hour because then I won't produce enough to pay the bills. And my thought on that is I realized a long time ago, when you're running behind and you're scared that you're not going to make enough money, either temporize and stop on the patient you're on or reschedule the next patient, because it's that fear of non-survival, the pressing for speed, the panic in which you make the mistakes that will haunt you forever.
Words to the wise, folks.
Innocent mistakes. The mistake you make because things are going well and your attention slips, that's an honest mistake. The mistake you make because you have to make a judgment and it turns out 2 years down the road it was the wrong choice, but you made it with good intention, that also deserves forgiveness. The mistakes you make when you take on a case that you shouldn't take on, and you make mistakes because you took on a case you weren't trained for, or that you're rushing to make more money and you screw up, that's another one of those mistakes that will haunt you forever. So the honest mistakes that your attention wanders for a fraction of a second and you screw up a prep, or you have a pulp exposure, or you have a pin out the side. Not good, but it's an honest mistake and you have to learn to forgive yourself. The mistake you make because you just did the right thing at the right time, but 2 years down the road, it's not holding. Again, honest mistake, you have to forgive yourself. The mistakes you make to take on cases you shouldn't have taken on, or rushing to make more money, those are the ones that will haunt you and you have a hard time forgiving yourself for. And at the end of your career, what hurts more is not that you don't have another $10,000 or $20,000 or $30,000 in your investment account. It's the mistakes you made that you harmed someone and you knew you should have done it differently. So that's why any of these decisions made on keeping the old doc, how to set up a schedule, if it's based on fear, try to step back from that fear, acknowledge it, and do the right thing. Because you don't want the mistakes that haunt you years down the road.
Perfect way. I want to end it, but I do want to give you an opportunity. You have any last points or things you want to say?
Yes. And it's, how do I say it? If a seller decides to stay on in the practice in any manner whatsoever, it is his responsibility to help make the buyer a success. That means if you have a suggestion, you make it to the buyer. If you have some ideas on what have and haven't worked in marketing, you pass those ideas on. Buyer's not obligated, but if you can help mentor, it is your responsibility to help mentor. If you are unwilling to make your new boss a success, get your butt out and let it go.
Folks, this is a doc who's on this side of the fence, okay? And that's as truthful and as pure, unfiltered, unaltered response to the doc selling the practice. Because I do think some people, they just think they got the payday and they just want to do XYZ now and still control it. And you're 100% right. You should be all about making that new doctor super successful. Thanks a million, Bob. I appreciate your time. Great perspective. I loved it. Thank you. Anybody want to reach you? How's the best way to reach you?
Either messenger or email, bob.finkel53@gmail.com.
Finkel, Finkel, 53@gmail.com.
But put something in there that says, this is from podcast with Dr. Spera. Otherwise, I'm not going to open it.
All right. Thanks, Bob. I appreciate it.
Have a good night.
You too.
This has been a production of Dentistry in General Radio Network. Visit our website, dentistryingeneral.com, to join engaging clinical and business conversations, explore our dental podcasts, and stay updated on our upcoming live events.